Hi there. How are you? I'm Nurse Callie. Nice to meet you. So, I will be beginning your physical exam today. That's okay? Okay, wonderful. So, I just want to start with a few questions just to get a little background. I know you're new to this clinic, so we just have to get a little bit of information from you if that's okay. All right, great. Let me just grab the iPad. Okay. All right. All right, so I'm gonna start by asking your full name. Okay. And what is your date of birth? Okay. And just in case the doctor wants to get you any medication or anything like that today, which pharmacy do you use? And if you know the address, could you give me the address? Okay, great. Okay. And which insurance do you have? Okay. Okay. And do you smoke? Very good. Do you drink? Okay. And do you use any drugs, any recreational drugs or anything like that? Okay. Okay. And are you taking any medications? And if so, what for? Just the vitamins. Okay. Any specific reasons? Any specific vitamins that you need for any health reason? Okay. All right. Is there any chance you could be pregnant? Okay. All right. And about how often do you exercise? Okay. So, what is your diet like? From morning to night? Okay. Any in between snacking or excessive cravings or anything like that? Okay. Okay, and what is your occupation? Okay. Are you required to do any type of strenuous lifting, pushing, or pulling? Oh, that's tough on the back. Hopefully you're bending at the knees, correct? Very good. Okay, and do you wear glasses or contacts at all? Okay. And you have an eye doctor that you see for that? Okay, great. Any problem with your vision? Okay, good. Do you require any hearing devices for any reason? Okay. Any problems urinating or producing a bowel movement? Okay. Have you had any surgeries in the past 6 months? Okay. And have you traveled outside of the US in the past 12 months? Okay. And are you experiencing any pain or problems today at this moment? Awesome. Okay. So some pain in the ear, the inner ear. Okay. All right, I'll write that in the notes here, and the doctor will see it when she comes in, okay? All right. And how long has that been going on for? About 2 weeks? Okay. All right. We'll definitely let the doctor know about that, okay? All right. Okay, great. So I'm just logging all this down. Beautiful. All right. Okay. And there is one more thing here. If you could, please, actually. Sorry, they just added this new form and I don't want to forget about it. I just need a signature here for treatment. Okay, great. Awesome. All right. So, I'm gonna get your height and your weight now, okay? So if you could just stand against that wall there. Beautiful. All right, and just stay still for me. You are feet, your heels right up against the wall for me. You are 5, 6.5. Okay, very good. All right, and then just step up on the scale here for me, okay? All right. 155. Wonderful. Okay. Very good. All right. Okay. So we're gonna start the exam now. And I just want to start by getting your temperature. So I have my little kit here. And I'm going to insert this in your ear. We use the ear thermometer here. Okay. All right, so let's just put that in your ear here. And what do we got? Come on. 98.9. Wonderful. Okay. Very good. Okay. And next, I just want to measure your oxygen, okay? Okay. And can I please have your finger? Okay. 98 beats per minute, 101. Awesome. Very good. Okay. So, I'm also gonna get your blood pressure, okay? So if you could, just extend your arm out for me. That all set up there. Okay. Just grab my stethoscope. All right. Let's tighten this up. Okay, and I'm just gonna need you to relax your arm for me, okay? Yep, just get nice and relaxed. Okay. Beautiful. 130/70. Okay. Very good. All right. So very normal. Very good so far. All right, and then next, we are going to check out your vision. Okay. So I want you to read this line right here for me as best you can. Very good. And can you read this line for me right here? Perfect. Okay. And what color is this line? Okay. And what color is this line? Perfect. And can you read this line right here for me? Okay. And the second line here. Wonderful. Very good. Okay. So next we're going to start the hearing test. And you're going to let me know which side you hear the beep, okay? So it's going to be either on your left or on your right side. All right, so let me just adjust these. The last person had a smaller head. Of course, no offense to you. You have a normal head. Okay. Perfect. Okay. All right, so I'm going to start my machine over here, okay? And you let me know if you hear the noise on the left side or on the right side. Okay. Can you hear that? Okay, I'll try again. Okay, very good. All right. Okay, so the last thing that I need to do is draw a couple vials of blood today. Since you are coming in for your physical, we just run a panel just to make sure everything's okay. All right? Okay. I'm sorry? No, we're only gonna collect about 5 vials today. Okay? Yeah, it's not gonna be that bad. 5 is a lot. Well, we have some patients come in for about 13 vials, depending on what they're getting tested for. So you don't have it too bad today. Okay. All right. Now, are you afraid of needles? Are you going to faint? Do you think you might pass out? Okay. So just relax. Take a deep breath. It's not so bad. It'll be really quick. I'll be as quick as I possibly can. Okay? Okay. So just put your arm out for me. Either arm will do. Yep. Okay. Okay. And just gonna grab an alcohol wipe. All right, and just take a deep breath, okay? And 1, 2, 3 in. Very good. Yeah, just don't even look at the needle. Okay, got 1 down. Got 2 right here. Okay. 3. So breathe in. Make sure you're breathing. Okay. 4. And 5. Awesome. Okay. And just stay very still, okay? I'm gonna grab the gauze. Okay. Very good. Okay, tape you up. Very good. You did excellent. It's not that bad. And I just have to turn these just so there's no mistakes in your results. So this part is important. Okay. All right, hon, you did excellent. And this concludes my part with you and the painful part. So your doctor's going to be Dr. Smith, and she should be in here in just about a few minutes, okay? All right, very nice to meet you. Take care. Hello. Hi there, how are you? I'm Dr. Smith. Nice to meet you. So, the nurse was talking to me. She told me that you're having some inner ear pain. Is that correct? Is it pain, discomfort? Is it like a throbbing pain? Okay. Right. Okay. So, we'll take a look in there and see what's going on when we get to that part of the exam. Okay? All right. So, I just want to take a listen to your heart, okay? All right. And just relax and just take a deep breath in for me. Okay, and again. Okay, and under your shirt a little bit. Very good. Sorry if this is a little bit cold. Try to warm it up a little bit. Okay. And just bend forward for me so I can get your back here. Okay. Over here. Okay. And on this side. Very good. Okay. Excellent. That sounded beautiful. one thing that the nurse forgot to do that is important is to take your glucose. So learn to check your glucose levels, okay? I can do that very quickly here. All right? So all it'll be is a quick little finger stick, and it should not be that painful, all right? Okay. All right, so let me clean your finger. Point your finger? Okay, and clean that off. All right, finger out. Just gonna squeeze your finger a little bit. Okay, and really quick. Deep breath in. Very good. All right. All right, I just need to collect it in the vial, okay? Awesome. Very good. Okay. All right, I'll just clean that off. Get you a Band-Aid. Very good. Okay. Sorry about that part. All right, so the next thing I want to do is to take a look at your eyes and your nose and your ears and all that, okay? So we're just gonna inspect a little bit. Okay. Okay. And okay. Very good. And next, I just want to take a look at your ears, okay? All right, so let's take a look at this one. Okay. And your other ear. Alright. Very good. Alright, so the next thing that I want to check are your reflexes. Alright? So, can you just put your arm out for me? And I'm going to bang in the base of your arm here and then your elbow. Alright? Okay. Very good. Alright, and your other arm? Very good. Alright, and then we're going to do your knees now, okay? So just come forward a little bit. Let your legs dangle over the side. Okay. Good. Very good. Very good. Okay, that's all normal. All right, so lastly, I'm just gonna have you lie on your back and just gonna feel your belly a little bit and have you do a few little leg exercises and arm exercises, and we should be good to go. Okay, so just lay back for me. Okay, fix this pillow up nice for you. Okay. All right, I'm just gonna lift your shirt up a little bit, okay? Just over your belly. Okay. All right, and I'm just feeling your belly now. Any tenderness here? Okay. Tender here at all? Okay. Alright, good. I'm gonna pull your shirt back down for you. Alright, and I'm gonna have you lift up your legs, okay? Just bend them at the knee. Alright, so let's bring this one up. And we're gonna bring it to your chest as much as you can. Good. And your other one. Very good. Okay. Wonderful. All right, and you can sit back up. All right, and there's one last thing that I do need to check, and that's your spine. So if you could please stand up. Very good. All right, and just turn around so your back is facing me, and just bend down, and if you can, touch your toes, okay? All right, I'm just gonna feel your spine. And does that hurt at all? Does it hurt at all if I massage this part or anything? Okay, excellent. Okay, very good. Stand back up, hon. Okay. So your physical went well. You seem to be very healthy. You just have some inner ear pain. So it sounds like an inner ear infection. So for that, I'm just gonna write you a prescription. You can pick that up today. What time is it now? What is it? 2:30. It should be ready by 3:30, I would say. Okay? All right. You take care. It's very nice to meet you. All right. Bye-bye.